How would you briefly describe your project to someone unfamiliar with what you do?
So our project was born to partner with primarily fire departments in the area to reduce ER visits and hospital readmissions for clients in the community. And we were focusing on doing this with a partner with the fire departments, but then also working with our Meals on Wheels program and registered dietitian to work one-on-one with clients to nutrition them in their diabetes or other chronic illnesses.
What is the why behind your project?
The why is to really help people, primarily seniors, age in their homes as they want to safely and independently with nutrition services and other community support. And then part of that would be, again, to reduce ER visits and hospital readmissions, and then overall would be to reducing healthcare costs for the state, local municipalities, and the individual consumer.
What has worked well for your project?
We have done a great job with the nutrition counseling, so our registered dietitians have been able to work one-on-one with seniors to really tailor their nutritional needs with our Meals on Wheels program to make certain packages of frozen meals for them to get that meet those needs and requirements. We also have utilized a frailty scale, which is a scale that is administered with our Meals on Wheels staff and the seniors every 3 months, and that allows us to track and identify other needs that they might have organically, or I guess through that scale. We've also worked with a healthcare economist, which is something we didn't know about before, and that person has been able really to look at our data, and as we wrap up our grant, figure out how we're actually saving money and can talk dollars to those who could fund this program in the future.
What are some challenges your project faced?
Really navigating getting into different fire departments. We were working in a large urban area and small rural areas, so different challenges for those. We found that a lot of times once we finally got buy-in from a chief or leaders in those fire departments, that maybe that excitement wasn't trickled down to the actual firefighters. So, and it wasn't that they're excited or didn't support the program, but when they're out doing a visit, a 911 call, you know, they maybe aren't thinking about nutrition as much as this person is in front of me falling, they need a home repair or they need something else. And so that challenge, we, even through education and training, was really hard for us. And then also just the initial cultivation of those relationships.
How did you find appropriate partners/partner organizations?
There is a tight-knit group of firefighters across our Central Ohio region that worked together to validate that we were a great organization to partner with. So that worked really well. And then throughout that, just having a good relationship also with healthcare providers in the community.
What funding sources have you utilized or will you utilize?
So we utilize primarily the Older American Act Fund to help support the actual payment for the home delivered meals. We also, through our medical nutrition therapy, which is, you know, the one-on-one counseling with the seniors, if they're diabetic, we're able to bill Medicaid, Medicare, and private insurances to help cover with that. But then there's a lot of gaps in the funding in terms of doing counseling for seniors who maybe don't fall into those categories. And so we do a lot of private fundraising. We have a catering company that does social enterprise. We have a couple other social entrepreneurship programs that bring money in, and then other private grants.
How will this project be sustainable once your grant period is done?
We're really lucky, so based on what we learned from this, we were able to secure another Administration of Community Living Innovation grant, so that will help support that. But in addition to that, we will continue to bill Medicaid, Medicare, and insurances for programs that we can, partner with Older American Act funds to provide support services and home delivered meals to clients. We also have some senior levy funds that we're able to partner with in the area.
What stakeholders do you need buy-in from?
For us, the fire department ended up not being the best route, and we found that we were identifying the needs of our seniors organically through different assessments that we were doing with our current Meals on Wheels clients, our brand new Meals on Wheels clients. So I think I would really evaluate if you have the capacity to really do that outreach and foster those relationships, knowing that maybe it won't warrant as much partnership in the future as you would hope. So really just looking at your capacity and then making sure you have the right people in the right place. So someone who does outreach might not be the best person to do really strict interventions with clients. So we found that we needed registered dietitians, we needed an occupational therapist, we needed social workers.
What advice do you have for trying to replicate a similar project?
I think, again, looking at the needs of your community, looking at what your capacity is, figuring out what your end goal is, and then working backwards from that. And then, again, making sure you really vet and have the right people working in the roles.
What do you wish you would have known prior to beginning the project?
I guess, yeah, so just how challenging this project would be, and that it's okay to shift in the middle to make sure that we are serving people where they are and what their actual needs are. So I think if we could have skipped all of the time that we did doing all this outreach and cultivating these relationships that really we didn't get much return on our investment from, and gone straight to understanding this frailty scale that we were doing, we're really getting the information that we needed to do more referrals. I think that would have saved us a lot of time, and we could have been deeper into our new project, or deeper into serving the senior better, knowing that information out the bat.